Good morning, everybody. Welcome to Dying for Healthcare, Medicare for All, and Racial Justice. Thank you for joining us today for our discussion. I'm Alan Barber, the Policy Director for the Progressive Caucus Action Fund. And for those of you who don't know, the Progressive Caucus Action Fund is a nonprofit organization that identifies and develops solutions to build a more equitable, just, and resilient United States and world. So in February of 2019, Representative Pramila Jayapal and Representative Debbie Dingell introduced the Medicare for All Act of 2019. Today, in the face of this pandemic, it's clear that now, more than ever before, we need Medicare for all. The coronavirus pandemic continues to wreak havoc around the world. Here in the US, as we all know, we've seen over 5 million cases of COVID-19 and 170,000 deaths. But importantly, this is a crisis within a crisis. Our nation's long-standing history of structural racism, xenophobia, and discrimination has been put on blast in recent years as cell phones and body cams capture moments of violence and everyday aggressions like having the cops called on you because your shade of brown or black seemed a little out of place in your apartment complex, or the ultimate sanction of dying of state violence, be that at the hands of police, or the structural racism that contributes to poor health outcomes. And now communities of color are bearing the brunt of this pandemic. Black, Latinx, and Native American people are getting COVID-19 and dying at staggering rates. While whites are dying of COVID-19 at a rate of roughly 35 per 100,000 people, blacks are dying at more than twice that rate at 80 per 100,000. Native people are unfortunately not too far behind at 66, while Hispanic people are dying at a rate of 58 per 100,000. Now, this is in part due to the susceptibility of these groups to pre-existing conditions that make COVID-19 that much more deadly. But it's also due to the fact that Black and brown people, particularly Black and brown women, are disproportionately working the frontline jobs that are keeping us going. Jobs like nurses, bus drivers, nursing home workers, grocery store staff, and fast food workers. Jobs that put them in high proximity to potential carriers of coronavirus, often with inadequate PPE or other protections. A slightly different shade of this structural racism that led to the overrepresentation in these fields by people of color contributes to higher rates of unemployment for Black and brown people in the broader economy, where the maxim first hired, first fired still rings true. And we can't forget that Black and brown businesses have been shut out of the COVID relief that's been offered to many other companies. And now millions of families are going hungry, facing eviction, and crucially, losing their health care in the midst of a pandemic that is giving us some of the highest, most astronomical hospital bills we've ever seen. Now, it's painfully obvious that the fight for Medicare for all is a fight for racial justice. So we're joined today by Medicare for All champions, organizers, and advocates, activists and healthcare providers who are on the front line of COVID-19. I'm so excited to introduce our incredible panelists. First off is Dr. Sanjeev Sriram. He's the Senior Advisor on Medicaid for Social Security Works. At Social Security Works, he leads a campaign called All Means All, which is dedicated to making racial equity a cornerstone of Medicare for All. Dr. Sriram, who many of you might know as Dr. America, is a health justice correspondent for We Act Radio, where he writes op-eds and makes innovative media to draw connections between health policy, inequity, and social determinants of health. Bonnie Castile, RN, is the Executive Director of National Nurses United, NNU, California Nurses Association, National Nurses Organizing Committee. She's an all RN professional organization and union with a membership of more than 150,000 throughout California and nationwide. Before being named as executive director, Bonnie was the director of the Registered Nurse Response Network, a disaster relief program run by NNU that places registered nurse volunteers where they're needed after man-made and natural catastrophes. Jennifer Epps Addison serves as the president and co-executive director of the Center for Popular Democracy and CPD's Action Network of 49 partner organizations in 33 states. She leads CPD's racial justice campaigns and has shared her own family struggles with the for-profit healthcare system. She has more than 15 years of community organizing experience, advancing systems change campaigns for economic and racial justice. And finally, Dr. Abdul El Sayed is a physician, epidemiologist, progressive activist, educator, author, speaker, and podcast host. He's the chair of Southpaw, Michigan, and a political contributor at CNN. He serves as a Sanders appointee and one of the 8 members of Vice President Biden's 2020 Unity Task Force for Healthcare. He's the author of Healing Politics, Calling for a Politics of Empathy to Cure Our Epidemic of Insecurity, and the forthcoming Medicare for All, A Citizen's Guide with Dr. Micah Johnson. He's the host of America Dissected, a podcast on crooked media, which goes beyond the headlines to explore what really matters for our health. He's a scholar in residence at Wayne State University and American University, teaching at the intersection of public health and public policy and politics. So we're going to be taking questions in the last part of this panel, so I encourage all the participants to please pose any questions that you might want to ask in the Q&A, and then we'll get to those later on in this session. But we're going to start off with a conversation with Dr. Sanjeev Sriram. Dr. Sriram, let's open up this discussion with you. Earlier this year, the All Means All campaign released important data on the disturbing reality of racial disparities in our current healthcare system, including fact sheets from every congressional district breaking down the minority health disparities. Dr. Sriram, you are not only the lead of the All Means All campaign, but also a lifelong advocate for health equity and a physician serving on the front lines of COVID-19. Can you tell us a little more about your findings on health disparities and the impact COVID-19 has on patients, particularly patients of color?
Sure. Thank you for the question and bringing us together for this important conversation. The All Means All campaign, like you mentioned, did publish fact sheets for every single congressional district. It outlines the number of people who are uninsured and juxtaposes that against every state's disparities by race for coverage. I'm just going to go ahead and put a quick link in the Zoom chat so that people can reference that for their future use. You know, when I look at the disparities of COVID-19 and how it has been disproportionately painful for families of color across the United States, what I see are predictable yet preventable tragedies across every part of the country. And the reason why I say that is that, you know, let's take, for example, the state of Colorado, the state that we were supposed to, you know, having this conference in. Latinx people make up 21% of the population. They make up 45% of the cases of COVID-19. And yet, you know, and I mean, I say that this is a predictable tragedy because before the pandemic, people of color made up 52% of Colorado's uninsured. And, you know, and nationwide, 59% of America's uninsured are people of color. And across the country, we see similar trends in, you know, in the nation's capital in Washington, D.C., where I work. You know, Black people are 47% of the population. They're 74% of the deaths from COVID-19. And on it goes. And what I feel that we are coming to terms with is that COVID-19 does not discriminate. Our healthcare system and a lot of the systems that are connected to healthcare have been discriminatory in ways that we have ignored and that have struggled to confront for decades. You mentioned that, you know, the communities of color and patients of color have pre-existing conditions. I caution people about, you know, about how they approach a lot of that public health and medical data, because these are not defects in biology. You know, I mean, like the science keeps telling us again and again that biologically we are 99.99% common. Like that is, you know, that our biology is, I mean, across the human race is fairly uniform. Like we have very, very little that differentiates us biologically. So these are not like COVID-19 is not revealing failures of biology. It's not showing any missteps or shortcomings of any kind of anyone's internal makeup. What COVID-19 is demonstrating is that our failures of society, and we have to be very honest and painfully honest about why do we have a healthcare system that makes eligibility such a function, such a cornerstone of where and how you get healthcare. To me, I feel that one of the most important things that we have to take away from, from this pandemic is to really dismantle eligibility as a construct. The only eligibility that any of us should require when approaching healthcare is our humanity. And instead, that's not what we have now. We have a fragmented system where every fragment of healthcare requires you demonstrating some element of eligibility. Do you earn enough money? Where do you work? What, I mean, what are your financial resources like? What state do you live in? How big is your family? All of these questions only serve to create greater and greater barriers for something that needs to be a fundamental human right. And that is what COVID-19 is demonstrating again and again across the country. And as you mentioned, people of color are disproportionately thrown at this pandemic because we keep labeling their work essential, but we treat the workers like they're expendable. And if we don't break that dynamic, if we don't fundamentally alter and change the culture of healthcare so that we stop seeing each other as some of us are expendable, some of us are not, some of us, have the luxury of staying at home, others, simply don't. We have to recognize that COVID-19 is not revealing failures of biology. It's revealing fundamental and chronic failures of what we've been doing as a society. But I'm optimistic that we can do better. And I look forward to having that discussion.
Thank you so much for that, Dr. Sharam. I really do like that frame that COVID-19 reveals the failure of a system and society, not failures of Black and brown bodies. I appreciate that. Next, we're going to turn to Bonnie Castillo. Bonnie, I want to thank you for being with us today. National Nurses United has been leading the fight for Medicare for All, and now you have a new fight on your hands, protecting nurses around the country in the midst of this pandemic. As Dr. Shriram mentioned, COVID-19 is exposing the weaknesses and downfalls of our healthcare system, not people. How has COVID-19 exposed many of the long-standing issues of our current healthcare system? How would Medicare for All make a difference for our communities and our doctors and our nurses who are on the front lines?
Sure. Well, thank you for having me. It's an honor to be here on this panel with such powerful activists and allies. So I want to start by saying that union nurses are very familiar with fighting for what's right in this so-called healthcare system, which is really a market, but this system, our market that actually cares about profits and not health. So we, as nurses have always sort of known that our employers were greedy and immoral and literally have had to fight for very basic things like safe staffing. So COVID-19 has simply supercharged our reality, all of our reality. And so nurses are now fighting literally tooth and nail for every piece of equipment that we need to survive. Months into this pandemic, we still don't have the optimal personal protective equipment, or PPE, as we say, that has put us and our patients and our loved ones at risk. And this is literally a fight for us every single day. So more than 1,350 nurses and other healthcare workers have lost their lives to COVID-19, including 11 of our members. And they died on the front lines of a pandemic, but they really died of a complete disregard for their lives. Throughout the pandemic, what we've seen is our profit-driven employers and government have completely betrayed us. They have actually calculated that they can afford to lose some of us along the way, which is why we've been fighting for decades to remove that profit motive from healthcare with Medicare for All. We know, when we've said this a number of times, that when we're not safe, our patients aren't safe, and especially our patients who were more at risk to begin with. So during the initial months of the pandemic, we could see that our Black, Brown, and Indigenous patients were suffering brutally. Nurses recognize and have recognized the social determinants of health, and we have witnessed the effects of racial discrimination long before this COVID moment. So when we see the CDC data and other studies showing that our Black and Latinx patients are 3 to 4 times as likely as our white patients to die of COVID-19, we know that those disparities are not just random. Prior to this pandemic, 8% of our white patients were uninsured, and in contrast, 11% of our Black patients, 19% of our Latinx patients, and 22% of indigenous patients were uninsured. Our non-white patients are also historically more likely to be underinsured and live in healthcare deserts that are caused by sort of cherry picking corporations shutting down, unaffordable hospitals and or services, and moving over to the more profitable neighborhoods. There's also obviously those folks are struggling financially at this time with the mass unemployment and you know, working those frontline jobs, going to work every day, not being able to be sheltered, and increasing their chances of exposure. So without the ability to get the care that they need, Black, Brown, and Indigenous patients disproportionately suffer from chronic conditions, putting them at great risk for very severe COVID-19 complications. And it's daunting. It's daunting in terms of what those hospitals look like. So we see our Black, Brown, and Indigenous patients suffering, and we also see so clearly how the fight for racial justice and the fight for healthcare justice are deeply interconnected. And it's our duty. It's our duty as nurses to stand up to this fight for the health and safety of our patients. And in the recent uprising, NNU nurses have engaged in Black Lives Matter solidarity actions in our workplaces We took it in front of our workplaces, in front of our facilities, protesting. And our leadership, our union leadership recognizes how important it is to take on the structural racism every day, including in their workplace, and serious self-examination. So for the past several years, and more recently, National Nurses United has been holding classes, forums, town halls, everyone. And these classes on structural racism are for everyone from our board of directors to the rank and file nurses, our union staff, and we actually even have a public series. And because we see how important it is to educate ourselves. Even early in 2019, NNU nurse leaders went to Selma and Montgomery, Alabama to visit the Legacy Museum and the National Memorial for Peace and Justice, and to participate in the 54th reenactment of the crossing of the Edmund Pettus Bridge. So I think, you know, we nurses are going to continue to struggle. There is not a choice here. This is our job. This is what we face, and we're going to stand up to fight for systemic change, because literally our lives depend on it and our patients' lives depend on it. To win, I think that we know that we have to continue standing with everyone on this panel today, and with the movement for Black Lives, and with our allies to fight for a society that values the dignity and rights and health of all people. For us, that means at the bedside and beyond. Thank you.
And thank you, Bonnie. And thank you for you and NNU for everything that you do day in and day out, putting your lives on the line for all of us, not only in the hospitals, but like you said, on the front lines of racial justice and equity. We appreciate all that you do. Next, we're going to turn to Jennifer Epps Addison. Jennifer, thanks for joining us and for all that you do. With the 2020 election right around the corner and our healthcare systems failing us in the face of COVID-19, the momentum for Medicare for All is growing. Done right, a guaranteed health policy system that includes racial justice can serve as a powerful model for future campaigns and could be a strong roadmap to racial justice systems change. CPD action is at the forefront of the fight against systemic racism, including fighting police brutality and fighting for communities of color during COVID-19. How does the fight for Medicare for All fit into that work for you? What can the movement for Medicare for All learn from the larger fight for racial justice?
Thank you so much for that question. And first of all, let me just say it is really an honor to be in this discussion in this moment. It could not be more relevant to what is happening on the ground in communities every day. And I'm so blessed to have organized with the folks on this panel, to have been arrested with them, to have, helped prepare the first, congressional hearings on single payer healthcare with them. So everyone here understands what's at stake for our people. At CPD Action, our network of grassroots organizations in 35 states, Puerto Rico and Washington, D.C., have been on the ground demanding a world where they can thrive. They're not asking to just simply not be killed by the police, right? Or to simply just not go bankrupt when they have to go to the doctor, or just simply not have their children separated from them at the border. They are looking to build the country of our dreams, and we get to do that in partnership with folks who are on this panel, in partnership with people all over the country. And we're learning so much from these social movements, from the movement for Black Lives and Black Lives Matter to the Dreamers movement. And we, people on the ground, every single one of us knows somebody who has, had a negative health consequence, maybe become disabled, maybe died because they didn't have access to the care they need in the moment that they needed it, right? And so, for us, it is so important for people to understand, and you can go to the Movement for Black Lives Vision for Our Lives, right? And it'll say this right in there. But it's important for people to understand that, Black Lives Matter is about so much more than just simply not being shot. It's about how we live in dignity in this country. It's about how every single person in this country, regardless of where you come from, regardless of what zip code, regardless of how much money your parents had, get to have a good qualified life. And we have the money for it. We live in a country full of abundance. The billionaires of this country have made hundreds of billions of dollars just since the start of this pandemic. Jeff Bezos got richer. This man may become a trillionaire because of this pandemic. And yet we are told always, when it comes to how do we survive, how do we feed our families, how do we get the care we need, that somehow there isn't enough to go around. And so this election, this pandemic, the thing that we need to understand more than anything else is everything we were fighting for before the pandemic that we were told is too far left, is too out there, is too radical, is exactly what we will need to heal this country and to make people's lives whole and to get us through this pandemic together. So, the election is critical, right? I want to be clear, right? There are two choices in front of us. We will either have a President Biden or a President Trump in 2021. And neither of those people has indicated their support for making sure everyone in this country can get healthcare when they need it, right? Neither one of them. Now let's be clear, more of us will have healthcare under a President Biden. That is undeniable. And so our job is to see forward to the future, is to hold strong to our values no matter where we're at in this country, as we are watching our brothers and sisters struggle, as we are providing mutual aid to each other because our government is failing to do so, right? We have to hold strong to the fact that we must work as hard, if not harder, under a President Biden than we have been working for the last 4 years to protect our people and to protect healthcare under President Trump. The future is not predetermined. Our communities and our ancestors have changed this world and reimagined this world and transformed this world 1,000,000 times over since the dawn of civilization. It is our responsibility in this moment to say we will not go back to the status quo. We will not go back. Nurses did not have enough PPE before the pandemic. This is not a new problem for them, right? So we will not go back to what life was like just before the pandemic. It wasn't good enough for our families. We will not go back to what life was like in 2016. That was not good enough for our people. We will move forward transforming this country, and I need everyone out there to commit the same energy you did under Trump to hopefully a new President Biden, because Medicare for all is the future. It is what our country needs to survive, and it is what Black people in particular need to thrive. Thank you all so much.
Thank you, Jennifer. And I don't think we can ever be reminded enough that we can't go back to what we called normal. That's just not going to cut it. We got to keep pushing, and we got to keep pushing hard. Thank you so much for that. Next, we're going to turn to Abdul El Sayed. Thank you for joining us this morning. You're an epidemiologist, a doctor, and a leading advocate for Medicare for All. You recently served as a Sanders appointee of Vice President Biden's 2020 Unity Task Force for Healthcare. And although this pandemic has exposed our country's dire need for Medicare for All, and nearly 70% of voters support Medicare for All, we still have a ways to go to make Medicare for All our reality. Can you tell us about the Unity Task Force on Healthcare and the role that racial justice played in your work on the task force? And can you tell us how you think our movement could relate to the work of the task force, especially in the context of COVID-19 and some of the excellent points that Jennifer just brought up for us?
Absolutely. First, I want to say thank you so much to the organizers for putting this on. Really grateful to be here with folks who have been leading in this movement for decades. And in particular to Bonnie and the nurses, you are our front lines in healthcare. And we have to learn to see healthcare from the eyes of our nurses, because theirs are the eyes that are looking at our patients most clearly. I want to tell you, it has been surreal in this moment to be watching as the city that I used to serve as health director, the city of Detroit, has been hit hard, particularly in the early wave, March, April, May, by COVID-19. And that led to a level of disparities in our state with respect to both transmission and death to COVID-19 that left, though 14% of Michiganders are Black, 40% of deaths to COVID-19 in Michigan have been to Black Michiganders, disproportionately in communities like Detroit and in Flint and in Benton Harbor out west. And so I was watching this and doing my best to work with public officials on the response, while watching as our country and our city was rising up against the twin pandemic of racism, which, by the way, takes 83,000 lives a year. And I'm quoting a study, 2005 study by former Surgeon General David Satcher, who served under Bill Clinton. And he just asked a very simple question. He said, if Black folks in America were to die at the same rate as white folks in America, how many lives would we save? 83,000 lives. And those lives lost can only be attributed to the systemic racism that wraps itself around every single system of our society. And so while we're talking about healthcare, because it's the tip of the funnel, let's not forget our housing system, our economic system, our broken infrastructure, the fact that folks in Black and brown communities are disproportionately breathing air that comes out of the smokestack of a large corporation because of the way that we've assented to providing energy via fossil fuels, because a few large corporations have decided that it should be so. All of these are the means by which Black lives are taken in this country. And then I was, every Saturday for 3 to 4 hours working with my colleagues on the Unity Task Force. And I'll tell you, when I was asked to join the task force, it was a really hard decision. And the reason why is because I've spent the last several years fighting for Medicare for All. When I ran for governor in Michigan, we ran on a state-level single-payer system. I've been working with my colleague, Dr. Micah Johnson, on a book that comes out in February called Medicare for All, A Citizen's Guide. And I believe that if we are serious about curing the pandemic, this pandemic of coronavirus, or the pandemic of systemic racism, or the pandemic of insecurity in our country, it starts with guaranteeing every single American access to unencumbered healthcare when they need it, where they need it in their communities. And the best way to do that by far is Medicare for all. But when the senator decided to suspend his campaign, and the question was, how do we move the Biden ticket in the direction of healthcare that is accessible to people, in the direction of taking on the corporate chokehold of our healthcare, and in the direction of addressing racial inequities and this pandemic? To me, I had to ask myself very simply, do you miss out on the opportunity to try and push forward on the issues that matter, even if you know that you're not going to be able to get all the way there? And and watching the courage of Senator Sanders and the work of all of the other task forces, I realized that this was a responsibility. I come to this political moment simply by asking what would be in the best interest of the people that I used to serve in Detroit, and what would be in the worst interest of the corporations that have held our healthcare system in a chokehold. And what we were able to come through with, a group of 8 people who I believe in earnest came together and asked, how do we make this public option meet this particular moment? Even though it had been litigated in the primary, even though Vice President Biden has some very clear positions on a public option, coming into the post-COVID moment with a pre-COVID healthcare plan just wasn't going to cut it, and everybody knew that. And so what we were able to do was to empower and improve the public option that he had ran on by making it truly public, by guaranteeing a deductible-free option to every single American, by making it free of charge, free of a premium for all Americans earning less than 200% of poverty, which means earning less than $52,000 for a family of 4, and then empowering Medicare to negotiate prescription drug prices on behalf of every single American. And then finally, one piece that I, alongside with several of my colleagues on the task force, including Mary Kay Henry, president of the SEIU, and Congresswoman Robin Kelly, we put forward an executive order that would mandate the federal government to look at the way that every single institution and agency of American government plays into the systemic racism that takes those 83,000 lives a year. Now, do I believe that it's enough? No, I believe in Medicare for all. A public option is not Medicare for all. But am I optimistic about whether or not this gets us moving in the direction of Medicare for all? I am, and here's why. Because again, when I think about those people in the city of Detroit and what they deserve, I know that they would be better served under a President Biden and under a public option that would be free at the point of care for 70% of Detroit residents, rather than under a continued assault on the ACA under Donald Trump. And I also know that sometimes, if you use an analogy of frogs jumping lily pads, the next lily pad may not be the one right in front of you in the direction you want to go. You may not be able to reach it. So sometimes you got to jump on a lily pad to the right and then jump forward. And so to me, I believe that Medicare for all is our future. I believe that the conversation that we're having here is undeniable. I believe in the truth of the fact that in the richest, most powerful country in the world, nobody should go without healthcare, and that we could do it more efficiently if the federal government was willing to stand up to the dominance of corporations and take this on. And that's why I believe it's going to happen. But I also know that in the interim, we cannot miss the opportunity to continue to serve people who have been misserved by this administration and who have suffered the consequences of this preventable pandemic in ways that have taken lives and taken livelihoods. And so I know that nobody here is satisfied with the outcome, but I also know that none of us have the option of allowing the opportunity to provide better access to healthcare go by the wayside because we don't believe it goes far enough. Let's do what we can with what we have in the moment that we have it, and then let's never stop pumping our legs forward until we get to a world where in this country, everybody gets healthcare without these premiums, without these deductibles, and without these copays. And that means that the minute we get to November 4th, and hopefully we'll have a President Biden and a Vice President Kamala Harris, then we keep going. Not only do we continue to put our legs behind getting this public option passed so that it is the law of the land, but we keep going through that outcome toward Medicare for all. And it's a big reason why my co-author and I decided that this book needed to come out in February, right? Because we can't stop organizing around this issue. People need to understand the truth of what we're fighting for, the opportunity we have to keep fighting for it, and the reasons why we fight. And I know that that this fight is long. I know that at moments you feel like things are lost, but I also know that the future is ours for the making, and I hope that we are willing to put our shoulders into making it.
Thank you so much for that. That was fire. Thank you. Really appreciate those sentiments. I want to remind everyone that all of the attendees that if you have any questions, you can pose those in the chat, and we'd love to address the panelists with those questions. I do want to take a minute to dig into a thread that kind of emerged while Jennifer and Abdul were speaking. This idea of what comes next, what we can do to end the commodification of people, of workers and patients that occurs in, as Bonnie put it, a healthcare market, not a healthcare system. I want to hear a little more from each of you about steps that you think we can take. I know someone dropped a link in the chat to the NNU campaign to win Medicare for all. Folks should check that out. But maybe we can start off, Bonnie, with some steps that individuals can take, and then we can turn to the other panelists.
Sure. Well, I think it is really important to look at this as, you know, in a frame of the long fight. So, you know, we have many, I mean, we are literally fighting for our lives right now, and that is directing us to stop the loss of life, literally. And so, yes, you know, NNU, our leadership, we have endorsed Biden. And, you know, I think that we have fought so many politicians in the, you know, being a union, our very, you know, our very existence as a union, as a collective, is threatened as well. And so we know how important it is defending, you know, to save as many lives as possible. And literally, you know, that drove our decision, but also, you know, that we are not giving up on Medicare for all. I mean, we have what is great is, you know, there's a lot of things that come at us that we don't necessarily have the answers, especially when you're talking about health but we know how to provide healthcare security for everybody that would have a dramatic effect for folks that are losing their jobs, losing shelter. I mean, you know, there's a whole lot of things that people need, but providing healthcare would provide so much security to folks and their families. In terms of what we need to do, it's beyond electoral, right? So we engage in electoral, that's important. We have to, with our profession, you know, our employers are attacking us in every state hall and the Capitol. And so, you know, we engage in that. However, we're very comfortable out on the street too. I mean, we're often there with our patients, bringing to light what is happening, and and as I said before, educating ourselves about what it's going to take and fortifying ourselves for this longer fight. So I think, you know, doing what we have been doing is important, but we have to also recognize this moment and step it up in terms of developing our allies and really coming together collectively again, and being comfortable with taking it on. I mean, just, you know, I can't tell you, and I'll stop here, how many endorsements we've done when it's like, oh shit, we endorse that person, you know. I mean, we're in a fight with them, and so and you know what, we're comfortable with that, and that's what we're going to do. We have to live to fight another day, and we will.
I don't think anybody can ever accuse any member of NNU of being afraid of the fight, and that is so inspiring for all of us. Dr. Sriram, maybe we can turn to you next.
Sure. You know, one of the things that I've been so motivated by is that, and you know, Abdul alluded to this, is that Medicare for all is doing. It has made such leaps and bounds in such a small amount of time. Like when I think about, you know, I was there when Congresswoman Jayapal introduced the bill in, you know, at the end of December 2019. And there was, you know, like less than 20 co-sponsors, like right off the bat. Literally a year later, half of House Democrats were getting behind, I mean, Medicare for all. And sure, in that half, you've got like a full spectrum, right? You've got like the super fans, like the people who are like really like, I mean, this is all they want to talk about 24/7. And then you've got the folks who are just kind of like lukewarm with like, yeah, okay, fine, I'm in that, you know, but it's not like they're real. The fact that you even have half of the US House of Representative Democrats, you know, I mean, interested in this, that it's actually gotten hearings, that I mean, the only thing that to me, the only growth that I've seen that's faster and more impressive is my daughter. All right. I mean, like, you know, it's like my 2-year-old is like, I mean, like that is like, she's the only thing that I know that outpaces the way that we're growing Medicare for all. And when I talk about it with friends and family is I really want Medicare for all to have a living and breathing identity that is in our here and now, in our communities. I actually don't talk a lot about what the UK and France and Australia are doing, only because one, they're going to be foreseeably white for the next several decades. We are not. Also, this has to be fundamentally ours. Like, it has to be that it is owned by our communities, the people that we love, the folks that we care about. So I talk about, you know, I mean, United Medical Center at the corner of 13th and Southern Avenue, right? Because it's like that is a tangible building full of the memories and histories that that community has given that place. It's the place where their, you know, their grandchildren have been born. It's the places where they've said goodbye to aunties and uncles. It's the place that they have, you know, seen triumph and tragedy. And to be able to say that, you know, this place should not struggle to stay open just because it's on, you know, the east side of DC as opposed to the northwest side of DC. You know, like no hospital, just because it's in a wealthier, whiter part of town, should have an easier time doing its job. That it should be that like any institution that we go to for healthcare should be able to do an excellent job. And, you know, able to actually speak to a living, breathing place in our communities and what Medicare for All would do for that, I think reinvigorates people. It gets people like more excited about the potential that they have for their own community and the reinvestment that can happen and what it would mean. I think that that builds an optimism that is really tough to build any other way. Like that's, I mean, when I see, like when I've been to teach-ins and when people start talking about Scandinavia and all of that, it's like eyes gloss over. It's like for a lot of communities of color, you may as well be talking about Westeros, right? I mean, you know, like a single payer works great from King's Landing to Winterfell and everywhere in between. It's just like I mean, like Scandinavia is no different than that Game of Thrones map. It's white peopling. It's like, what does that have to do with us? What does that have to do with like what's going on in our community? Versus when you're able to talk about this hospital over here that keeps seeming to have problems staying open year after year, that problem ends. And instead, they're going to expand their mission of health for you, that this will be a place where you can find a job. This is a place where you don't have to worry about crossing town to give birth to a baby. Like, I think that that is the type of optimism and determination that we can build with each other so that Medicare for All feels real and it feels like ours. It doesn't feel like some abstract foreign idea that is just like landing on people and helicoptering in, but it's actually something that is becoming part of our identity in an America that is rapidly becoming majority people of color.
Thank you for that. You know, we do need to be reminded that Medicare for All isn't abstract. It's not some giant up on the hill that just we're waiting for it to come down. We need to make it. We need to actualize it. We need to bring it here ourselves now. What I want to do now, first I want to remind everybody that if they have questions, they're more than welcome to weigh in our chat. I know somebody has something out there that they're thinking about asking us, so please do. But while we wait for those questions, I want to turn again to all the panelists and ask what gives you optimism about this fight right now and where we are. Jennifer, you're next in my Zoom lineup, so I'm going to go to you.
Yeah. I mean, as bad as the system is for poor and low income and working class people, I think we have to remember that this for-profit health insurance system doesn't work very well for middle class or, sort of slightly wealthy people either, right? And I said everybody has a healthcare story. My father a year ago almost died. He had a massive heart incident. We thought we were going to lose him. He was in a coma for several weeks. Thank God for the nurses, because it was the nurses who day by day advocated for him. It was the nurses who, when we said you cannot let them give up on him, were really there fighting for him, and who were taking care of him and who literally nursed him back to health, right? And I remember when he finally woke up out of his coma and he finally recovered enough to go to a rehabilitation facility. And my mother was told that my father, a Air Force veteran of this country, that he should sell his house because he wouldn't be qualified. He would not be able to get accepted to the rehab facility unless he could prove that he could pay for all of the services. And so because insurance only, his private insurance, right, only covered so much. And so I really think it's important for people to understand how broken this system is, and, in terms of how it delivers care to people, everyone across the spectrum, even if you have what is supposed to be good private health insurance, that we cannot, a system rooted in the profits of corporations will never, never deliver the care that our communities need, right, that our families need. And so really, what are the steps? I mean, we're in the middle of a pandemic where more than 40 million people have lost their job, right? And for many of those people, that means they have also severed their health care. The House passed the HEROES Act months ago, right? And it includes important measures for PPE and for, states and cities and hospitals. And we want a version of the HEROES Act to pass. But it also really ties whatever healthcare people will have in this pandemic to COBRA, right? To putting massive profits into insurance companies' pockets. And so we really believe that there's an opportunity for folks to contact their Democratic senators to say, we need to amend the Senate version of the bill so that people automatically get enrolled in the Medicare system when they lose their job because of this pandemic and they lose their health care. We already have a single payer system that works, a system that people can enroll in, that is open enrollment. We can do this simply and easily, and we should be advocating for putting people onto a system that they can trust and believe in, that is not tied to making massive profits for insurance companies. And then you got to call these Republican senators, and if you're in a Republican state, and even if it only feels like there's 5 or 10 or 15 of you, you got to show up and make some noise. These people, excuse my language, I was about to get, these folks went on vacation for August in the middle of a pandemic when millions of people cannot get health care, are not eating, don't know how they're going to pay their rent. They're home in your district. So if you live in Ohio, or you live in Pennsylvania, or you live in Georgia, or you live in Texas, if you live in a place where there is a Republican senator, you need to figure out where these guys are at. They're not social distancing, so it might not be that hard to find them, right? And you need to make sure that they hear your voice and that they need to come back and pass relief for people, not for their corporate buddies, not, another couple $1 trillion for big business, for Jeff Bezos and the like, but they need to pass real relief for every person who is living in this country struggling right now. So if you want to get to a place where we can have a future for Medicare for all, we have got to fill this stopgap by fighting for real relief for COVID right now.
Thanks, Jen. And it looks like we're getting close to our time for the day, but I do want to turn really quickly to Abdul for any closing thoughts on optimism or next steps that we can take to make Medicare for all a reality.
A lot of really, really great comments shared here. I'll say 3 things. Number one, to Jennifer's point about the way that this this system is affecting the middle class. I interviewed a woman named Lisa in Michigan who had a heart attack, very rare heart attack. She's 37. That was 3 years after her husband had a brain tumor that he had to get removed. He has to get regular MRIs, and her follow-up has taken years. They have private health insurance. They just had to learn what a deductible was the hard way. And every year they pay out their deductible between January and March to pay for their extended care. And that's when their insurance kicks in. The fact of the matter is that our system is so broken that they've figured out how to force us to pay twice. And all of that to sustain a system where 15% off the top on both sides goes to overhead, both the payer and the provider side. Second thing I'll say is that the real problem here, and I just want to folks to understand this, is that in our system, you think of yourself as the customer, right? Customers have choices. We're not the customer. In our system, we're the product. So if I were to go to a grocery store right now, and let's say I want to buy some tomatoes, I put my tomatoes there, the grocery clerk weighs them, and they say, you want the tomatoes, you're the customer, you're going to pay X amount of money for the tomatoes. The way it works when you get healthcare in America is that the financial transaction isn't really between you and the people who paid for your healthcare. You and your employer, if you're lucky enough to have one, have been paying into a system that then pays for your care. So actually, you're the reason that a financial transaction happens between a payer, an insurance company, and a provider. That makes you the tomatoes, not the buyer of the tomatoes. And herein lies the problem. We need to stop letting ourselves be commodified so that truly we actually can become customers in a system. And the only thing we really care about is not the insurance. Nobody cares about choices in insurance. People care about choices in doctors. And really the only way to open up choices in doctors and nurses and hospital centers is to make sure that they take your insurance, which means that there's one insurance for everyone. That's what Medicare for All does. The third thing I'll say is this. I know that this moment can feel frustrating for a lot of folks. We have been fighting like hell. But to Dr. Sriram's point, I want you to remember where we've come in 5 years. Medicare for All is the lingua franca about healthcare. It is the plan to which every other plan is compared and estimated. And the fact of the matter is that if we take our foot off the gas now, we will have been falling into the trap that everybody wants to set for the movement for Medicare for All. They want us to think that we have lost. We have not lost this fight. In fact, because of the way that this has shaped the culture of healthcare, because of the conversation that is being had here and all over the country about how we could do this better, we are winning this fight. And legislatively, it may not be as linear as going from what we have now to Medicare for All. But our job is to keep our eyes on the prize and continue to walk forward, foot after foot, step after step, shoulder to shoulder. And if we can do that, I know that this will be the future for our country.
Thank you, Abdul, and thank you to all of the panelists. At the Progressive Caucus Action Fund, we're proud to stand with you in the fight for Medicare for All. Thank you all for your tireless work. Today, we're saying again that the status quo is just not acceptable. On measure after measure, racial bias mars our healthcare system and costs people of color their health and their lives, from how often pain is treated for patients of color to the frightening number of maternal fatalities among Black women. As we've talked about, these regrettable health outcomes are paired with a health insurance system in which we are the product. It shouldn't be a cliche that people have to resort to begging on GoFundMe to afford a life-saving surgery for their for-profit insurance that their for-profit insurance company denied, but that's our reality. In the midst of this pandemic, asking yourself if you can afford to get care should be the absolute last thing on your mind. The coronavirus pandemic has exposed what so many of us already knew, that our healthcare system is cruel and fails working families. We hope that you'll join us all in this fight for Medicare for All. And that's about all the time we have for today, but we invite all of the participants to join us in the virtual hallway. I want to say thank you again to our amazing panelists. Thanks to everyone that's watching out there. And especially thanks to the nurses, the doctors, the EMTs, the nursing home workers, and the other frontline workers that are fighting to keep us healthy every single day. Have a great day, everybody. Thanks. Thanks again, everybody. And Sanjeev, the 2-year-old comment, I was on mute just as you were talking about your daughter when my daughter just decided to just start singing her favorite new song, Frozen. She didn't know how to sing songs a week ago, but now she does. Like you said, they just grow so fast.
Yeah, mine's singing Sugar Hill Gang, so I'm just
Oh.
like, I mean, it's like, I mean, Frozen was last week, and then I was like, where did Sugar Hill Gang come from? And I was like, listening to her in the backseat of the car, I was like, and I'm like, telling her, like, do you want to listen to this on Appa's iPad? Like, I've got it, like, right here. I mean, because I'm like, listen, if I have to listen to Elsa one more damn time, I'm
Right.
like, like, it's like,
And besides, who wouldn't take Sugar Hill Gang over doing
Right.
themselves anyway,
yeah. Yeah.
But thanks again. This was great as always.
Thank you. Yeah, this was great. We should definitely find more opportunities to do this together. It was really fun collaborating with everyone.
Agreed.
Well, thanks, y'all. You did a great job. I'm going to close out the meeting. Have a great rest of your day.
Take care, Jeremy.
All right,
Awesome
take
work.
care. Thank you.
Thank you so much.